Today we're going to be talking about how activation of the vagus nerve can help with depression. And the reason why we're going to be talking about this is because this publication that looked at collection of randomized clinical trials, which are the highest level of evidence in medicine that is used for determining whether intervention works or not. So it's very interesting to determine, is vagus nerve neuromodulation or activation working in this regard based on the most powerful evidence. And also the reason why the authors focused on depression itself is because of the pandemic, COVID-19 pandemic. According to the statistics that these authors provided, did a horrific number on increasing the levels of both depression and anxiety. I'll give you the stats right away. And another reason why is because vagus nerve neuromodulation is emerging as a very exciting, easy to use method in potentially dealing with depression. So I presented some information in a previous video that talked about how women with long COVID that were being studied for long COVID symptoms, they also exhibited decreased level of depression. So then this prompted me to look at this study, which looks at even broader level of information. All right, let's get started. My name is Mikolaj Rashek, Dr. Mikolaj Rashek of Neurogenomics. And before we get going, I just wanted to let you know this video is sponsored by Neurosim. Parasim is the company that makes vagus nerve neuromodulation device that is currently certified for medical use on the European market. So they're the sponsor of this video. They let me study what I want as long as it's about science, published science about the vagus nerve. And this is something that was of interest to me. So they're the sponsors. And if you're interested in this device after watching this video, check out the link below, because in the video description, because you can get a discount for such device. But I'll give you both the benefits that the authors of this publication, which have nothing to do with the makers of the device, what benefits they mentioned and what limitations they mentioned as well. Okay, so let's get going. We're going to talk about some of these depression statistics. So these guys mentioned that approximately 280 million people are diagnosed as, say, clinically depressed in the world. Now, obviously, all of us have experienced depression at some point in our lives. This is normal, actually, right? We all experience a very wide range or gamut of emotions, and depression is one of them. In order to be clinically diagnosed with depression, it requires specific duration of time as well as length of exhibiting specific behaviors or mental state during the day. So keep that in mind. If you're thinking this number should be higher, this is what we're talking about here specifically. And of course, depression can be classified as mild, moderate, and severe. Okay, and that's might already sound like a great number. And by the way, they also mentioned that your life prevalence that you would experience such depression level of depression large enough that you could be clinically diagnosed as depressed is about 20% in each person's life. So approximately 1 in 5 people will experience such an event at least once in their life. So quite a lot. And they even mentioned that by 2030, it is expected that depression will constitute the largest disease burden in the world, which means it already must be quite a large one, because 2030 is not many years from now, it's just in a few years. But they also mentioned that the COVID-19 pandemic did a horrific number on depression and anxiety, and they mentioned the quoted statistics that in 2020 alone, that number of people being depressed rose by more than 50 million people globally. So that's almost 30% increase in a single year. That's 2020. And for people with anxiety, this was over 70 million people, again, single year. And remember, in the pandemic, both 2020 and 2021 were these horrific years where we had to contend with a lot of draconian basically conditions that were absolutely abnormal to any of us. And of course, that that resulted in a lot of cause for depression and anxiety for a lot of people. Hence, not a surprise that the first 2 years, which were really shocking to most people in terms of how we had to deal with this health problem, this would happen, right? Well, big rise. So I wouldn't be surprised if the 2021 statistics were not different from 2020, but hopefully once as 2022 emerged and 2023, of course, life started to return back to normal. And hopefully, this would be my hope, that these statistics would start dropping as well. But the take-home message is that clearly there's even grand increase in people who are depressed. Now, let's talk about what happens when it comes to treatment of depression and the standard approach, the first line of intervention that most global guidelines provide, especially for both the moderate and severe depression, is number one, antidepressants, so medications, drugs, and number two, psychotherapy. And the most common form of psychotherapy that is used is cognitive behavioral therapy. And basically what that is as far as I follow it, is recognizing pattern of negative thoughts and behaviors and being able to start reducing these aspects or elements of your life so that we don't dwell in that state. All right. So, however, having said that, they also mentioned some of the problems that we have to encounter on account these first line approaches in treatments. And number one is that up to 1/3 to 50% of everyone who will take drugs for depression, the drugs will not work for them, which is quite astonishing and quite sad. And the reason why is because a lot of these antidepressant medications can come with quite unwelcome side effects. And this can include something as mild as headaches, but even greater complications such as nausea, cardiovascular diseases, sexual dysfunction, and severe enough that a lot of people in the end decide to drop use of such medications. So that's already a problem. And on top of that, they take quite a long time to take effect. So usually at least minimum 4 weeks. Now, if you are drug resistant, if you are a person who is not responding well to the medications, and a side note, if you're not, I highly recommend to consider pharmacogenetic test. And the reason why is because with my experience with working with such a medical DNA tests is that when it came to mental health medications, this is what clients appeared to be most sensitive to. Basically, everyone was getting a hit for some mental health medications, and this is where we saw greatest variety. I highly recommend, if you're considering taking drugs, antidepressant drugs, consider pharmacogenetic tests as well to determine good quality pharmacogenetic tests, I should add. They're not made equal, in order to determine which medications might actually potentially provide you with greater benefits than not. And that might actually reduce this amount of failure amongst such patients. Nevertheless, if a patient is a drug resistant, they also have an option of trying to do something like it's a brain therapy, electroconvulsion therapy or something like that. It's basically where you send a small painless current through the brain in order to induce seizure. But even then, approximately 25% of the time that will also fail. It will not work either. So, and then when it comes to the cognitive behavioral therapy, that's a version of psychotherapy, one of the big issues is that it takes time and it's expensive. So the people who might not be able to afford it, that might not be able to, they might be excluded from that as well. And the take-home message behind all of this is that we clearly need additional methods in terms of how to deal with depression, how to intervene with depression. And the vagus nerve neuromodulation seems very, very promising. Now, why even is it linked to treatment of depression? The authors of this meta-analysis provide a very nice background. Meta-analysis, by the way, means looking at already numerous published studies, and we'll go into details of that. And they mentioned, look, the reasoning behind this actually came only in 2002, so quite recently, right? It's still not even 25 years, when, based on anatomical work on cadavers, it was understood that the vagus nerve can innervate our ear, both like the inside here as well as this lip part on your ear called tragus, and via the auricular branch of your vagus nerve, auricular meaning related to your ear. And that same branch then can go to part of your brain called the nucleus of solitary tract, or tractus solitarius if you're looking for more exotic Latin name. And from there it can connect to other regions of the brain that can be involved in the development of depression. And if you're wondering about these connections, check out one of my past videos describing anatomy of the vagus nerve, the video that I discussed how the vagus nerve activation can modulate your heart rate variability, which is a good thing. So basically the signal goes to your brain first when you activate it via your ear, and then it can go to other organs, including your heart. So that's the premise behind it. And the very first time there was any mention, oh, by the way, they mentioned a very first time ever that the vagus transauricular, which is meaning via your ear, vagus nerve neuromodulation was ever demonstrated. The authors of this publication think was only in the year 2000. And they said perhaps, they specifically said perhaps because I guess they weren't absolutely certain if this was the oldest reference they were able to find, but it still gives you an idea how new this technology is. It's not even 25 years old. Thank goodness we already have a certified medical device available for the market, but it shows you in a way as well how slow of a process it is gaining this important knowledge. And I'll give you a more information about that as well. So that's only in 2000, right? And 2002 was when they started doing the anatomical connection. I believe they mentioned that the very first time that any study was done using transauricular vagus nerve neuromodulation in terms of dealing or treating depression was only in 2009. So again, very recent. And the very first randomized control study, like the ones that have highest evidence that we normally want and seek, was only done in 2013, and it showed that the vagus nerve activation via such device indeed reduced the depression scores compared to a sham, or basically fake activation of your vagus nerve. All right, so then since then, a number of other studies have been published, including one meta-analysis already. So meta-analysis, again, is when you compile the results of many other publications and you use this compiled information, you pull it all together to determine how effective intervention really is. So as a consequence, these meta-analysis studies are some of the most sought after, most desired studies, really, that give us powerful tools of information, or like powerful source of information, what can really work versus not. So I personally really like meta-analysis. They will have some of their own limitations as well, but basically that's what we're talking about today. And however, the authors mentioned that previous single meta-analysis ever done had its own limitations, i.e. they use some poor quality studies, and also they use non-randomized clinical trials, which the authors claim, that's not good. Personally, I think that is good, but these authors wanted to focus only on randomized clinical trials, because that's considered to be the highest base of evidence for how we should decide what a medical intervention should be used for any type of condition. So this is what these guys did. They decided to look for all the latest information just for randomized clinical control studies. Okay. Now, I personally think we should be looking at other stuff as well, because we're hungry for building this evidence so that we can know on a faster basis what really works. And just because a study is not necessarily randomized clinical trial, that doesn't mean it might not yield very valuable results. Anyway, this is what they did, and they did researched it, and they found 12 studies ever in history using this type of approach, the non-invasive transauricular vagus nerve neuromodulation. So via sending electric curve on this part of your ear, 12 studies, total number of participants was only 838 people. That's very, very low number. That's hugely disappointing. And the reason why is because you need much, much higher numbers to really get really high quality evidence. So to give you an example, I did some meta-analysis recently. I did one for my Patreon account where I discussed mushrooms in terms of whether they might be reducing mushroom consumption, in terms of whether that might reduce the risk of cancer. And that particular meta-analysis, I believe, might have been somewhere around 20,000 people altogether. And I also did one recently on exercise with regards to helping with symptoms of depression, and that meta-analysis, including all of their studies, was maybe somewhere around 14,000 people. So you see huge numbers, and this didn't even reach 1,000 people. The reason why is because all these studies, they had somewhere between 40 to just over 100 people at most in each study. And there's one more surprise thing, is that of those 12 studies, all but one came out of China. So basically, this type of knowledge, this type of scientific knowledge, is really of interest to our colleagues in the eastern part of the world. The western part of the scientific world does not seem to be interested in this type of science seemingly at all at this point, in terms of pumping out clinical trials, despite the fact, which is surprising, because despite the fact that the data looks so promising, as I will be telling you right away. So that's unfortunate. And basically, obviously, the take-home message here is, let's hope that this will change, that our Western science colleagues will smarten up and start pumping out such studies as well. But thank goodness we have people in the eastern part of the world that is much more keen in looking at alternative approaches to treating certain conditions, including, say, cancer, depression, than just maybe standard medications, which is great because we need that knowledge as well. So that's 12 studies, 11 from China, 1 from Germany. What did they do? Basically, the experiment group, so the group that was looking at the vagus nerve activation, that basically included people who always were activating the vagus nerve via a device. So people who were either doing just that, or people who were doing that plus treatment as usual, basically meaning going to your doctor and being treated for your symptoms, but not taking antidepressant drugs. And then those who took drugs basically for depression as well. So all of these combinations. Now, when it came to control group, it was basically all options that did not include vagus nerve neuromodulation. So that basically included sham, or a fake activation. So typically people will clip the same device, but to the earlobe, there is no vagus nerve there. It will do nothing to such a person. The only thing that such people might have at that point working in their favor is their placebo effect, which is basically your wishful desire that something is helping you. And that's powerful enough that you can see effects. This is why we need to look at it. We need to look at the effect of wishful thinking, because it does indeed. Brain is powerful enough that it will induce changes, positive changes, even when there is no treatment added, right? But it also included people who took antidepressant drugs, or antidepressant drugs and treatment as usual. All right, so these were the control groups, okay? And then basically we're comparing these two groups. So what were the comparisons? So the primary outcome of interest for the authors was basically the response rate. And what does that mean? If a person started the treatment or intervention, so they're starting at a certain baseline, and if their depression symptoms reduced by 50% or more, they would be considered a responder, okay? So first, the primary outcome that these guys were interested in was what is the response rate between the vagus nerve neuromodulation versus those who did not use it, okay? They also looked at a whole bunch of secondary outcomes. So they also looked at basically how much the depression scores were reduced by the vagus nerve neuromodulation versus the controls, which is either nothing, fake treatment, or antidepressant drugs. And that's number one. They also looked at how your anxiety scores reduced by these treatment approaches. And the last one was your safety outcomes. So they wanted to see how many people dropped out, how many people quit because they couldn't handle it, what was the adverse event rate amongst these studies, and what were the side effects. And this is also very interesting information. All right, so then let's start looking at some of the results. So first, they looked at all of these combinations that use the transauricular vagus nerve neuromodulation versus control, meaning you either had the fake treatment or you took the antidepressant drugs or you had antidepressant plus treatment as usual, and they compared the two. Which one was more effective? And they stated that the group that was activating their vagus nerve was statistically significant, had a statistically significant higher response rate than the control group. Now that's, remember, all of these studies combined. By the way, when it comes to how many studies reported response rate, that was 10 out of 12 of these studies actually looked at that type of information. Okay, so, and they quoted that via risk score. So what is a risk score? It's basically your relative risk. You compare one group to the other, and they did it as a fraction. Basically, they looked at how much more likely the control group was not going to respond in comparison to the vagus nerve activation group. And basically, for the outcome was about 1.28. The RR, the relative risk, was about 1.28 times more for the control group than for the vagus nerve activation, meaning that vagus nerve activation was doing better in terms of having more responders. Now that's combining everything. Then they also subdivided. By the way, I like that relative risk to be shown as a fraction of one as opposed to more than one, and they focus on the control as opposed to the vagus nerve neuromodulation group. But that's just basically how the authors did it. So then we start looking at subcomponents. So what about vagus nerve neuromodulation as opposed to just that fake sham neuromodulation where you're not really activating your vagus nerve? And here the results were astronomically good. Basically, the relative risk score was more than 12. So so basically, the point here is that fake treatment was not working, and you had far more responders, far more likely to see a response with an actual intervention than if you did something that is fake, that doesn't even do anything. Except these people, or if everything was done correctly, they would not have known whether they're getting the fake treatment or not. So big difference. Now then they looked at vagus nerve neuromodulation versus antidepressant drugs. And here, as far as the authors didn't comment on this, but when I looked at the data, that also looked statistically significant. It was about 1.22 RR figure for the control, meaning that here, vagus nerve neuromodulation had more responders in terms of reducing their depression symptoms than the actual medications. Very interesting. Now, how about the last group, last component, those who did vagus nerve neuromodulation as in conjunction to the drugs versus those who just took the drugs The the relative risk score, was 1.19, I believe, 1.2, but it was not statistically significant in this case. So we could say, well, statistically, it means really both of these groups were responding similarly. So whether you did just the drugs or the drugs in combination with the vagus nerve neuromodulation, similar number of people were responding. All right. So, but that's just the response rate, and then they looked at how much people responded. So now they studied scale of response, or basically scale score of how much your depression score dropped due to the intervention. And again, only 10 studies showed such results. And they measured it slightly differently. They used Hedges G value. And this not only provides you statistical significance, but also the magnitude of response. So just to make it simple, if the response is 0, it means there is no difference really. If the response is around 0.2, it means that there is a small effect of the intervention. If the response rate, Hedges G, is 0.5, it means that it's moderate effect difference. And if it's 0.8 or more, then it's a large effect difference between the two groups. And this is what was being looked at. And now let's break it down again. So first we're going to look at all of the different groups that were looking at vagus nerve activation. So that included just the activation, or activation plus drugs, or activation plus drugs and treatment as usual, versus all the controls. And that meant sham activation, or a fake activation, versus those who just took the drugs, and so on. And again, there was statistical difference of significant effect. From memory, it was more than 0.8. It was negative 0.8 because the depression scores were dropping for those who took the vagus nerve neuromodulation approach versus all other approaches. And yeah, so that's all groups combined. So then again, let's start breaking it down one by one. When it came to vagus nerve neuromodulation versus the sham one, the fake one, again, astronomical difference. It was almost negative 1.5, meaning that those who did the vagus nerve neuromodulation, their depression scores dropped significantly more than whatever was observed for those who were using the fake neuromodulation. That makes sense because, again, those people were not doing really anything in terms of intervention. The only thing that would have been working in their benefit is the placebo effect. So again, their hope that something is working. Now, again, let's take a look at the vagus nerve neuromodulations versus just the medications, just the drugs, the antidepressant drugs. And in this case, there was a significant difference as well. Oh, sorry. In this case, there was no significant, or there was a moderate effect, is what I'm trying to say. Moderate effect of about 0.3. So what does that mean? Recall that when we compared in terms of responders, the vagus nerve neuromodulation had more responders, so more people who actually showed some effect. But in this case, the effect difference might not be that large between the two groups, but at least more people are responding. So those who took the drugs or the vagus nerve neuromodulation, their response rate might be very similar in terms of the size of response, but more people were responding overall when they took the vagus nerve neuromodulation approach. So that's interesting. Now, the last one was those who did the vagus nerve neuromodulations with drugs versus those who just took drugs. And in this case, we saw again large effect response, almost negative 0.1, meaning that those who did both the drug and the vagus nerve neuromodulation, they saw a bigger effect, bigger drop in their depression scores than those who just took drugs. Now remember, when we were comparing just the response rate, similar number of people were responding, whether they did the vagus nerve modulation and drugs versus just drugs. But even though it's a similar number, they're responding more powerfully to the combination of both the vagus nerve and the drug. So that's very, very interesting as well. It basically, no matter what, it seems like the addition of the vagus nerve neuromodulation is a beneficial addition. Now, let's move on. When it comes to anxiety, only 2 studies looked at that information, and there was no effects. We're gonna drop it, so we're just going to move on. So let's take a look at the side effects and so on. So basically, what are the safety outcomes? And in all of the studies, only 2 people dropped out, both of them due to intolerable pain. One of them included a person who cranked out the machine too rapidly, and it rapidly shot very high current level. And of course, that would have been very painful. I can tell you, I've done that as well to myself on purpose. Though I wanted to see what will be my tolerance level when I use this machine. You can control this with this device, the NeuroSim device. And in my past video, I was telling you what are the instructions of the provider, the maker of the device, and they say you need to increase that slowly. And I tested that once. I wanted to go fast and see, like, oh, where do I go? Let's see how tough I am. And whoa, it got painful. That current depends on how sensitive you are. That current that they can zap you with can go very high. It literally felt like someone putting thick needle in my ear, right? I normally go at most maybe half of the ultimate level that I think the device allows you. So just be advised, this is not something you just put on your ear, go zap, and you go, because you can literally quickly increase the magnitude of how much electrical current is being sent through that device, through your tragus on your ear. So that's 2 people dropped for that reason. The other person they didn't explain. Of all the studies, only 2 studies reported any adverse events. No studies reported any serious adverse events. None. 2 only reported mild adverse events, and they included such things as headaches, dizziness, mild sickness, and reddening of the skin around where the device is used. All of these symptoms disappear quickly after termination of the therapy. Oh, and by the way, I never perhaps mentioned how the therapy was being conducted. Let me throw that in right now too, because that's also very useful information. That should have gone in much earlier at the start. So basically, for the therapy, what the authors describe on average what was being done with in terms of the vagus nerve neuromodulation is that these people use these devices once or twice a day for 15 to 30 minutes tops, up to 5 to 7 days per week for 2, 4, 6, or 8 weeks. So if you're looking for this use of this device to deal with certain symptoms that are bothering you because of long COVID, well, keep in mind that this might not be just like one session or 2 sessions. This is can take numerous days. It's the same thing that we saw in the last video dedicated to using NeuroSim, the device that I'm promoting in this video, for treatment of, or basically intervention in long COVID women, and they were using it for 10 days. So these studies are even longer that were described in this publication are even longer. Okay, so what's also interesting is that they mention that when it came to side effects, because the device seems to be so safe, and this is mantra that comes out from these type of studies over and over and over again. This is, remember, we don't know anything long term though, but when it comes to these short term use for a number of weeks in a row, the message that comes out again and again is that they're very safe. This seems to be repeating this pattern. And when the authors of couple studies compared the safety in terms of side effects outcomes when it came to use of vagus nerve neuromodulation device along with antidepressant drugs versus just the dead drugs, it reduced the actual side effect scores. So that's really interesting, because it means to some degree you could be using the device in order, if you are taking the drugs, you could use that device as an adjunct device, not only to improve their results, but potentially also reduce the unwanted side effects. Really interesting. And they even mentioned that in some degree, their use of this device might have even been curative. And that's the actual word that they used, curative, meaning it cured something for, and the reason why they brought it up is because most of these studies were done on people who were either mild to moderate depression. So I think this was 8 out of those 12 studies, but they also had some data on severe depression. And they said, look, this is also potentially really, really powerful because in some instances, severe depression was reduced to even mild depression. And that's very valuable because according to these guys, severe depression is not easy to treat. At least this is the message that I'm getting from what these guys are saying. The reason why is because the success rate is not high and there are these side effects, right? So this might be very, very promising tool for the future. They say we should definitely be investigating this in greater detail. And on top of that, in some instances, it helped to cure certain comorbidities in such patients. And the two that they provided an example of were number one, insomnia, and number two, pain. So they're saying that even for some people, transauricular vagus nerve neuromodulation could be like almost like 2 for 1, because not only could it reduce the depression symptoms, it could also get rid of some of the other comorbidities for you. I would say even 3 for 1 if you also taking the antidepressant drugs, because the third one is potentially reduce the side effects associated with the antidepressant medications. So really, really interesting stuff. All right, so now let's talk about limitations really quick. The biggest problem is that there's not enough studies, and all these studies are very small in size. They're very small in scale. So that's issue number one. And issue number two, and as a consequence, because of the issue number one, they said, look, potentially this could mean that the effect of the vagus nerve neuromodulation could be either overestimated or underestimated. So in reality, it might not be as good as it seems right now based on this analysis, or might be even way better. It's just simply the statistics, the number of individuals involved might not provide us with the most accurate information, is really what we're getting at here. Okay, and the other issue is that the level of evidence, whether this information is true or not, and is truly accurate, whether this is such beneficial intervention, is either low or very low. So it's on a lower scale, and in fact, they mentioned because of this, doctors that might be interested in this, they should look at this information with caution and use such approach in a clinical setting with caution as well. So whatever that means, because they didn't elaborate on that, I would imagine that if there are any doctors who are interested in this type of approach for their own patients, perhaps monitor such individuals for the success rate very carefully as to what's happening, because the level of evidence overall, it's just not large enough at this rate. However, the overall conclusion of these authors is that this appears like the vagus nerve neuromodulation is an effective method for treating depression, at least in mild to moderate condition, and on top of that, it's very portable, it's very easy to use, and it's very cost efficient because it's a one-time purchase for a device, and might supersede antidepressant medications because of the side effects. It might be better than psychotherapy because of the cost of psychotherapy or even other brain modulation approaches, which might be difficult to operate. So overall, the message here by the authors is that this is very promising, positive approach. However, because of the low level of evidence, we need more high quality, expansive, randomized double-blind clinical trial data in order to really sort of solidify how effective is this method in dealing with depression, and what kind of how long it might last for, and what kind of depression is it actually best for. Okay, so That basically is the conclusion of this paper. I thought it was super interesting because, again, very, very simple intervention. Very, very fascinating. I wanted to share this with you. And please leave a comment if you have experience using any type of vagus nerve neuromodulation. Let us know if you have used NeuroSim and we haven't corresponded. Please let me know. I do collect this type of information personally for my own personal use. Sometimes I share this with you in the videos, and just give me your thoughts. Give me thumbs up on a video if you like this. Share. This is how we spread this knowledge. This is still new knowledge. A lot of people will not know this. And as you can see, there's a lot of people suffering from depression. And I'm also looking a little bit more in greater detail lately in depression. Check out my previous video as well in terms of how exercise could be helping dealing with depression as well, what type of exercises for men versus women and so on. Very neat stuff. And finally, please also check out my Patreon account, where I cover additional topics that do not make it to the YouTube, but that also includes depression as well, because I've been on the roll. And I look forward to seeing you next time. Bye, everyone.